Hello, Dasha here, kinesiologist, and you're probably here because you have back pain. This video is for you. This is going to be a 20-minute soothing breath work and stretching session to help your lower back muscles relax and to get you feeling good and getting you back to everything that you want to do. Before we begin, red flags. So if you've had a recent car accident or a recent fall or a recent really bad injury, change in bladder or bowel function, loss of muscle ability in your legs or anywhere else in the body, a fever, this might not be the best thing to do. The best thing to do would be to go seek medical attention, see your doctor, your physio, to get an assessment to really figure out what's going on and if there's any other interventions needed. Everybody else, if you don't have any of those red flags, this video is for you. We know that you're safe to move and that your body would benefit from motion and your back and your pain will decrease if you get things moving. As long as you practice within your comfort of tolerance. And so what does that mean? That means moving in ways that you feel safe to move. So don't do anything that feels like a lot. Don't make your pain go up through the roof because that means more pain. So we want to do things that are tolerable, where your body can stay relaxed and you can still breathe normally as you move. Those are really great activities for you, your pain, and your back and your muscles. So jump into something comfy, find some floor space. A yoga mat could be great, not required. If you're on a squishy surface, that's okay. A hard surface like a floor is going to be better because your body will feel that support. All right, let's get started. Let's begin on our back. You're going to be laying down and however your legs are comfortable. So they can be straight. I know sometimes that can really pull on the hip flexors and be uncomfortable. So I like bent because that relaxes the hip flexors and relaxes the lower back. And we're going to begin with a little bit of breath work. So you can place one hand on the belly, one hand on the chest. And let's just start with a big sigh. The reason for the breath work is as we begin to decrease the intensity of the nervous system, so we bring everything down, your muscle tension will come down as well, and your body and your muscles will all start to relax and start to create that safety in the body. And that's what we really want because the nervous system and pain, they're like this. So when our stress is high, our pain is high. When our stress is low, our pain is low. So in order to decrease our pain, we need to bring down our stress. So start by one hand on the belly, one hand on the chest. Let's do one more sigh. You can make noise with your sigh, that's totally fine. And then we're gonna just start by thinking about lengthening our exhale. So you're gonna lengthen your exhale just by a little bit. You can breathe out through the mouth or the nose, whatever feels comfortable. Normal inhale, in through the nose if you can. And again, lengthen that exhale again, just by a smidgen. And that's perfect. So keep going with that, just a little bit longer each time. And just notice how the body already is starting to settle, which is perfect. That's exactly what we want. We want the body to just relax a little bit. Let your back relax into the floor. Let your legs relax into the floor. You're creating a container of safety for your body. So you're allowing your body to let go a little bit and know that it's okay. It's okay to let go. It's safe right now. And that breath work as you lengthen your exhale, that's your body language. That's what you're using to tell the body that it's safe to let go, it's safe to relax. And you might notice that your breath is slowing down, your body is slowing down, and there's this tendency to want to take a little pause at the end of your exhale, and that's perfect. Just go with that. Don't force anything. So you're not forcing a really long exhale and then a really long pause. You want it to just be very subtle, very relaxed. And let's just take 3 more breaths. Nice long exhale. A little bit of a pause. Helping the body be more and more relaxed with each breath. Maybe even noticing the heartbeat. And last one here. Nice work. So our first movement today is a pelvic clock. And with all our movements today, I want you to really feel comfortable. So you don't want to be pushing anything or forcing anything. What I want is for you to be soothing your body and really listening to your body and going only as far as it feels comfortable. So the first one is this little rocking of the pelvis. And like I said, less is more. So we don't need it to be really big and really forceful. It can be really tiny. So just even this little tiny rock of the pelvis, and you're creating a bubble of safety for your body. You're basically saying, what I'm doing here is safe and feels comfortable and is soothing to my nervous system and my muscles. And you may notice that as you do this, it kind of becomes a little bit easier and a little bit smoother, and that's perfect. And the reason why I really like this one is because the back and the spine is supported, and so you're not actually doing any work to hold up the body with the lower back, but you're just letting the lower back move in that flexion and extension without doing a ton of work. Okay, nice. So then the next part of the pelvic clock is this. We're going to move the hip up to the rib and then move the other hip up to the rib. Your belly button is your pivot point. And so we're rocking back and forth like this, almost as if you've got attitude in your hips. And again, same idea, less is more. You're finding a range that's really comfortable, really easy. You're like, no problems, I got this. And the reason for that is because if we are doing something that's easy, then the rest of our body is really relaxed and our breath is really relaxed. And that's another body language to tell the nervous system that it's okay to let go. It's okay to let go and relax, and we don't need to hold on so tight. And then once those tight muscles let go, suddenly, there's less pain, there's a little more room to breathe. Okay, next motion. Your knees are going side to side. Good, but again, less is more, so it doesn't have to be very big. Notice your breathing here. Notice if you're holding any tension. Let it go. And again, it can be this big. It doesn't have to be very big. Tiny is good. And here we're doing a little bit of that rotation for the spine. Hands to the floor might feel nice as well. Okay. Beautiful. Yeah, really nice work. So we're going to repeat that pelvic clock one more time. So starting with the pelvis, rocking into flexion and extension. And again, I'm going kind of big. It can be small. And you might be noticing that already things are kind of shifting and changing, and it's not as tight anymore, and that's perfect. So we're trying to lubricate with motion. We're trying to get that body to be smooth and relaxed, the motion to be smooth. Beautiful. And then attitude hips again. So hiking one hip, hiking the other. Again, nice and soothing. So if you're starting to feel like, ow, that's really too much, way smaller. Or if on one side it doesn't feel as good, just less is more. Very nice. And then let's take the knees side to side. Hands can go to the floor. Yeah, very good. Notice the breathing here. Good. Okay, so the next one is a little bit more of a stretch. So we're going to bring the knees into the chest. Give them a nice hug. If the knees don't like that in terms of the bending, you can always go underneath the thighs like that. Yep. And then we're rocking a little bit back and forth. And again, take it smaller. It could look like this. That's nice. Or it can look a little bit more like this, where it's becoming a bit bigger. Whatever feels comfortable. Good. And then let's bring the feet back to the ground, and we're going to take a little bit of a bridge. So this is a harder exercise, and the idea here is we're going to activate the hamstring and the glute to help the lower back let go and to help activate these muscles to help support the lower back. So you're going to use your fingers. You can put them kind of into the back of the thigh, into the bum, and feel the muscles here squeeze as you slowly lift the pelvis, and it can go just as far as you're comfortable. So again, it doesn't have to be all the way up here. It can just be this like tiny little motion. Good. And back. And even if you're just getting these muscles here to engage, perfect. That's exactly what we want. So again, squeeze back here, push your feet into the ground as high as it feels comfortable, and then gently back down. Yeah, and your spine's like a string of pearls, so one vertebrae at a time is lifting up. Beautiful. And let's just do two more, if that feels good. Squeezing those hamstrings, squeezing those glutes. And I like to put my fingers into that like bum crease area. Really feel like this bum crease here is squeezing. Nice. So that one's definitely a little bit more of a challenging one. So if you feel it a little bit, that's okay. Again, play within that safe zone. So as long as the rest of the body feels calm and you can keep breathing, that's a good place to be. One more thing I'll say about that is we don't actually want the core or the front of the legs to be doing the work. So maybe just do one more. Poke yourself here. Are you really tight here? Or can you let go and be soft in the belly? Yeah, so the softness in the belly is what we want. We actually want here to be tight, right, in the back of the legs, but softness in the belly. Good. Okay, beautiful. So next we're going to do a nerve floss for the sciatic nerve. And with this one, you don't want to hold it. So we want to keep moving. We're just going to put the hands behind the leg there, behind the knee. We're going to straighten the leg, point the toe to your face, let it go and let it go. And so maybe 5 to 10 of these, and you're looking for a feeling that's kind of down the leg, that's maybe telling you like, ooh, okay, that's something stretching. If you're not feeling it, you might do a head lift at the end as well. But same idea, we're staying in that container of safety. You want to feel safe in this movement. You want to be able to breathe and let the rest of the body feel relaxed. Very nice. Okay, maybe 1 or 2 more if that feels good. Beautiful, and we'll do the other side. And so for this, what we're doing is we're stretching the nerve that goes from your brain all the way down your spinal cord into the back of your leg and all the way into your toes. And so our nerves are also soft tissue, and that means they need to move and stretch with our bodies as our bodies move. And for many different reasons, the nerves can become tight, whether there's impingement or something poking at them, or just even tight muscles can inhibit our nerves. And so we're just helping that nerve glide and stretch, staying in that safe range. And you might notice that one side feels different than the other. So for me, my right leg is definitely way tighter than my left, but I just play within the ranges that's comfortable for them. Okay, next, let's flip on over. We're gonna go to hands and knees. Okay, and if you need a bit more padding for the knees, grab a pillow for your knees if that feels gonna feel better. And so the first one, we're gonna go into what is called the child's pose. So we're gonna bring our hips back. You can let the feet be flat if that feels better, just as low as you're comfortable. And then you're coming back up, and we're gonna time the breath here. So you're gonna go down, breathe out, up, breathe in. Beautiful, and if you can breathe in through the nose, that's even better. Long exhale. In through the nose, and move at your own pace. So whatever feels comfortable there, listen to your body. Find that rhythm of your body. And again, only as far as it's comfortable. So maybe if it's just to here, that's great. And then come back up. Let's just do 1 more of these. Good, that's looking good. And the next one we'll go into cat-cow. So your belly drops as you breathe in. Your chin goes up. Your belly rises, spine rises and curls. Chin's tucked in as you breathe out. And rinse and repeat. And so here we're starting to work with the whole spine. So from your coccyx all the way up to your head, everything is moving together. And again, as far as it's comfortable. So you don't want to grin and bear it. You want to be able to breathe really comfortably. And if you're starting to feel good with this one, we can do a little bit more. So we're gonna go into a barrel roll. So that's adding a little bit of that side flexion into this motion. And so you might take the belly down, the waist to the side, the waist up to the other side and down. And then the head moves in the opposite direction. Beautiful, and you might go in the other direction, and you might start to play with this motion a little bit, feeling out the shoulder blades as well. Feels good to sometimes bend the elbows, or maybe just sway back and forth at the top or the bottom. Yeah, nice. So you're really feeling out your body, asking your body, what does your body need right now? And maybe just that cat-cow is enough. So just listen to your body. Good. And I've got one more for you that's a little bit more intense. So if you're feeling good today, or if you're starting to feel better and you're like, okay, I can do a little bit more, we're going to take this tabletop up into a down dog and maybe walk out the knees a little bit. Breathing still. And come on down. And if that felt good, maybe one more. So just one more coming up, walking out. Beautiful. And back down. Aha, good. And let's finish off with just a prolonged child's pose. So hips go back, hands maybe forward, maybe just stack them and put your forehead on the top of your hands. Nice work, everybody. And a nice soothing exhale. And here we're going to come back with a little bit of breath work because your belly and your chest is a little bit compressed by your thighs. And so it's going to be harder to breathe in. But what is going to be easier is to breathe out. And so really noticing that exhale, making it really passive. Maybe a little bit of a harder inhale, and then a nice, long, passive exhale. And let's just take one more of those. Nice, long exhale. Yeah. And thank you so much for taking care of your body today. You could thank yourself for taking care of your body. You did a great job. And you can come back to any of the things we did as many times as you like through this lower back flare-up, or even to prevent the lower back flare-up, to just give everything some motion. And I like to say motion is lotion and movement is medicine. And so thank you for using your movement medicine today. And I'd love it if you subscribe to the channel. And I'd also love it if you shared this video with a friend, somebody who you might know who's going through lower back pain right now and just needs a little bit of love and care for their lower back, something to help them soothe, something to help them bring their nervous system down, and just to remind them that they're okay. They're going to be okay, and soon enough this is going to be over, and they're going to be feeling better and doing all the things that they love. Thanks so much for watching today.